The following segment is presented by Bremo Pharmacy.
There are more than 32 million Americans who take at least 3 medications a day. But how do they manage it all? Because if taken incorrectly, the results can be devastating. Here to tell us more is a pharmacist from Bremo Pharmacy, Jennifer Helmke. Thank you for joining us.
Thank you for having me.
Now tell us about medication management therapy, or is that the right word for it?
Medication therapy management, MTM as it's commonly known as.
Okay.
And that is a service provided by some pharmacies, and at Bremo Pharmacy we focus in on our senior care population. And what it is our patients can come in and have a one-on-one consultation with a pharmacist to go over all of their medications. And we like to have our patients bring in all of their medicines so we can go over and physically look at each one to make sure that the patient understands when to take it, how to take it, what's it for, what to expect from that medication, and to review some of the side effects that potentially could be happening.
Going back to that statistic, so many people are medicated. I mean, if you're not taking your medications correctly, it can be fatal, right?
Absolutely. Almost 90,000 Americans die each year from adverse medication-related events.
Wow. So what you do is you bring them in, like you said, you have this consultation, and what should people know about? There could be one person on all of these medications you see here. What should they know about what they're taking?
They need to know what each medication is for, how to take it, if it needs to be taken in the morning or in the evening. Does it need to be taken with food to avoid potential side effects, such as ibuprofen? It needs to be taken with food to avoid stomach ulcers and GI bleeding, and making sure that the side effects, that the potential side effects that could be happening, make sure they are not happening, and to be sure that if they are going, may be dizzy from that medication, they know to be extra cautious and careful and not take it while driving, or don't take it right first thing in the morning, maybe take it at nighttime.
And you also advise your seniors and all of the patients who come into Bremo to get your medications at one place, because there's dangers in getting prescriptions filled at different pharmacies, right?
Absolutely. A lot of senior patients take multiple medications and see multiple different providers. And when a patient sees multiple providers, they may not know what the other provider has given them.
One specialist may prescribe this, another one prescribes that, and then you just have a bunch of pills at the end of the day.
And if the pharmacy doesn't know all of the medications that the patient's taking because they've been filled at different locations, it can be very difficult to manage and catch all of the potential adverse effects that may occur. So we want to keep them safe and well and healthy at home as long as possible.
Well, thank you so much for coming in. I really appreciate it. Really quickly, any feedback you've gotten from patients?
Our patients have really liked this service that we've had to offer them, and really have a more confident understanding of how to take their medications.
And that's what it's really all about. If you would like to find out more about medication therapy management, just visit their website at bremorx.com.